Than 48 hours are left before Kenyans begin registration into the Social Health Authority that is set to replace the National Health Insurance Fund. Our Health and Science reporter Elizabeth Atieno reminds us of the history of NHIF, whose end is in the offing.
The journey of NHIF began in the 1920s when Kenya was a British protectorate. The Europeans and Asians had their health insurance cover, that is, the European Hospital and Treatment Relief Fund and the Asian and Arab Fund Authority, which helped the contributors obtain treatment from the more expensive and exclusive hospital, while the natives could only access the ill-equipped and overcrowded government hospitals. In June 1963, the then Attorney General, Honorable Sir Charles Njonjo, wrote to the new native administration about the idea of having a national health scheme that would bring equality among Europeans, Asians, and Africans. Sir Njonjo's dream was later realized in June 1966 when an interim National Hospital Insurance Fund (NHIF) scheme committee delivered the NHIF Act, marking the start of NHIF, a state parastatal established as a department under the Ministry of Health. The 1966 Act of Parliament has over the years been reviewed to accommodate the changing healthcare needs of the Kenyan population, employment and restructuring in the health sector. Currently, an NHIF Act No. 9 of 1998 governs the fund. The NHIF membership is open to all Kenyans who have attained the age of 18. Currently, there are 17 million Kenyans dependent on NHIF and approximately 22.8 million beneficiaries.
Health insurance coverage remains low at 25% and lowest among the low-income group at less than 5%. The out-of-pocket payment by households for health standards at 150 billion shillings annually.
UHC Supercover is Kenya's largest reliable, accessible and affordable medical insurance cover and costs 500 Kenya shillings per month for the principal members and beneficiaries. National Health Scheme members can access various benefit packages under the UHC Supercover. The packages include inpatient, outpatient, maternity, renal dialysis, oncology, radiology, overseas treatment, and emergency care services. However, the National Health Insurance Fund has had its fair share of challenges, the latest being the 20 billion Kenya shilling graft scandal, where approved fraudulent claims were granted to 78 health facilities.
Nafanya mabadiliko kwenye National Hospital Insurance Fund kwa sababu pale sitaki kusema sana, kuna changamoto kubwa.
Just assure members of the public that any resources that were stolen from or through NHIF will be pursued until they are brought back or the people who are involved are brought to book.
In light of the millions of public funds lost through fictitious claims, the Ministry of Health proposed a paradigm shift in the provision of social health insurance through the Social Health Insurance Act of 2023 that has repealed the National Health Insurance Fund Act No. 9 of 1998.
Working on a report and what they have seen, what they have touched as an asset of NHIF has been tagged, and that has been put into the report for handing over to Social Health Authority.
There is going to be a vetting process to ensure that only those officers who are clean, who are not corrupt, who have not been found in any corrupt practices are the ones who are going to employ in the new Social Health Authority.
This is the history of the 58-year journey of NHIF that will soon come to an end as the Ministry of Health is set to commence the registration of Kenyans into the Social Health Authority from the 1st of July 2024. Elizabeth Atieno, TV 47, Nairobi.
Thank you.